There are three main options here if you are considering a full mouth replacement of teeth. The best option for either the top or bottom arches would be the hybrid prosthesis. What this is an implant-supported dental bridge. What that means is there are implants placed in the bone underneath the gum tissue and a bridge that it is a full arch of teeth that gets attached to those implants and stays in place. It does not come out of your mouth. Typically the way that works is you'll see an oral surgeon. They will place several implants in your mouth at the time of extracting teeth or perhaps at a future appointment. At that same appointment, they will install a temporary dental bridge. While the implants heal over the next several months, a permanent dental bridge is made in a laboratory, and you will return to our office. We'll remove the temporary bridge and place your permanent bridge, which will be highly aesthetic and very strong. Another option is an implant retained denture. This is a good option for the lower arch. What this is it has some similarities to the hybrid prosthesis, but also some key differences. The similarities is that it's implant supported, meaning it's going to attach to a couple to several implants. The main difference, however, is that it is a denture, meaning it is something that is removable. Although it will snap into the implants and have increased retention because the implants help it stay there, it is something that will come in and out of the mouth. Our third option, and this is mostly applicable to the upper arch, would be to do a cosmetic denture. What that involves is removal of all the upper teeth, fabrication of a custom fit denture, and as the tissue and bone heals over the next several months, if necessary, we will also make you an additional denture, a final denture, that will be highly aesthetic and highly retentive. Keep in mind, if you do not have implants supporting this denture or any cosmetic denture, because it's not implant supported, over time it will become loose because the tissue and the bone will recede.